Assalamu alaikum, marhaba, and hoş geldiniz. I'm so glad to be over here because this is my first time to come to Antalya, but maybe the 7th or 8th time to come to Turkey. Usually I come to Istanbul. So my name is Jamal. I'm a co-chair of ZIMAM. ZIMAM is an international association for the e-health workforce development for everybody. Also that I'm a family physician, professor of family medicine, clinical informatics, chairing the family and community medicine department at King Saud University. And I'm so glad over here to share the topic that we have. I'm so glad to hear the Japanese experience from Professor Sankai. So, arigato gozaimasu. And that's part of it, which is the technology. To have a strategy, we have to focus into three things. Technology is not everything. We can buy the best robotics, we can buy the best electronic health systems, but if we don't have the workforce, the talents who operate that, we will fail. So we have the workforce, we have the technology, and we must have the operations standards and policies to improve. So, Bismillah ar-Rahman ar-Rahim. This is my disclosure. I don't have any conflict of interest. I don't have some of the companies over here or brands. There is no conflict of interest. Who knows what is this? Anybody knows what is this? Train station where? In Medina. This is the Hijaz train stations. My father's high school is just behind that, over here, in the right side. So usually we go from after Haram. I'm from Medina, so usually we go for a breakfast over here, and just in front of this is Ambariya Mosque. This is Ambariya Mosque in Medina, and this exists over in Medina for more than a decade. Why did I bring this picture over here? If you want to make transformation, and if you want to make change, don't fight the legacy systems. Don't fight the legacy system that you have, build on them. So the secret of change is to focus all of your energy, not on fighting the old, but building on it. Building on it. Otherwise, you will fail in the change and transformation. So this is an organizational level, and the national level, and the global level. We need to not to intervene the wheel, but to build on the legacy systems that we have and build on that. So there are no digital quick fixes. There is no systems or a recipe or digital transformation that you make a paradigm shift and you improve the health of everybody. Make a plans and phase by phase on that, starting from the current status with good vision, and that will take at least around 10 years and beyond that. So, and the latest report from the Gartner, which sector do you think is most likely to benefit from the fourth industrial revolution? All sectors, energy, infrastructure, finance, education. But the most is the healthcare. In the healthcare, 45% that will change with the fourth industrial revolution. So, as I said before, there is little investing in the latest technology. We should have the technology, but without investing in people, in education. So maybe the battery. Okay. I hate to stand over here and engaged, but I could focus right now. Okay, so there is a little point investing in the latest technology if there is not a workforce with the right roles and skills to make use of the full potential to benefit from patients. And also on the vice versa. There is also little point in investing in skills. We could have best universities, best education schools, but on obsolete systems, obsolete infrastructure, that also will not improve our health. So the digital health profiles and proposed digital capabilities framework, we need to bridge the gap. We need to bridge the gap between the clinical and technology, and bridge the gap between the research and the actual practice that we have on live. So this is the quadruple aim that we have in the transformation, in any digital transformation, whether in the country level or the organizational level. We need first the most important thing is to improve the the better health outcomes. We need to have the better health outcomes. We need to have the better health outcomes, better clinical outcomes, healthier people. But at the same time, our patients need to be satisfied and have got better journey and better experience. And also our doctors, nurses, pharmacists, health allies, all of the health professionals that need to have got improved healthcare. Not a nightmare, not a pajama times where they go to their homes and complete the dictations that they have. We need the technology make their life easier, the doctor life easier, the patient life easier. And also that we need a sustainable financial model to sustain with lower cost of care and higher effective. So more than in the cost effective period. This exercise that I did in my department. In our department, we calculated, just imagine our patients in the hospital. The average time the patient live in the hospital, whether in their outpatient, emergency, inpatient operations, the average time during the whole life. Just guess how much? How many hours? The average time? 122 hours only. Compare that with what is the life expectancy of our patients in Turkey? 77 years, okay? So in Saudi around 78 years, in Turkey 77 years. If we calculated this, almost 700,000 hours. So we are caring about the data only in the hospital through the electronic health records and the advanced systems that we have. While on the other hand, the remaining time outside the hospital, we don't capture data about. Do you know what's the percentage? The percentage is only 0.02% of the data that we capture inside the hospitals, whether primary health care, outpatient, emergency, inpatient operations, is only 0.002%. If we want to improve the health of people, our digitalization transformation should focus on the whole picture of the life and look for the genome, look for the patient-generated data, look for the operating systems, wearable devices, and all of that will make the change. Otherwise, we'll just be within the world of the hospital and clinics that we have. This is our journey in Saudi that I'm happy to share with you, that part of the National Vision 2030 that we have, and these are the national visions and we have in the right side, and we have got the healthcare transformations in Saudi Arabia. Then we built vision realization offices in each sector. We have in education, we have gotten the pilgrimage and support, and part of it is the workforce, and that caused the shift of care. Then we have, these are the 6 forces shaping the e-health transformation in Saudi. Transformation agenda, the new services that we have, including the new model of care and the new operating model, new technologies, including social media, mobile devices, artificial intelligence, the cloud, and the security. And we called the personalized care, patient individual's care, and that's been shifted to the university's curriculums and the cultural change. If we look at the new model of care, 6 systems of healthcare, model of care design with 6 layers. Previously, in the old model of care, we started with the primary care. This is not correct anymore. We start with the activated person. We need to empower patients to take care of their health. Then after that, the healthy communities. Health is not only in hospitals. Health is not only in clinics. We are not only even in the primary care. We need to activate person. So we have health in schools, health in Jama and Masjid, health in work, health in every place. And also that the primary care, general care hospitals, secondary care, and the tertiary specialized care. In the same time, these layers, we have horizontal, crossing systems. We have the wellness, the start safe birth, urgent care, chronic care, and end of life and last phase care. And from that one, we came up with initiatives and projects. We have got around 42 initiatives for the new model of care. 3 of them are dependent on technology. The virtual self-care tools, the virtual education and navigation tools, the integrated personal health record, what we call NAFIS, or the National Platform for Health Information Exchange. And these, the e-health transformation programs that we have in Saudi, we have got the national standards and policies, the information securities, the digital infrastructures, citizen e-health services through the unified mobile and digital twins, the clinical solutions and the business solutions, and the advanced technologies and analyticals, and the health information exchange called NAFIS. So, the standardizations and governance. To start on that, we had national standards that for the diseases, for medications, for procedures, for the labs, and this is unified and this is forced. We could not force all the health sectors to have the same electronic health record, but we forced them to use the same standards for the exchange. Then after that, we had the healthcare ecosystems data domains, and we published the Saudi Health Data Dictionary. That's available. You can just Google it. There is a unified terminology across all the health systems, regardless, Ministry of Health, private sectors, university hospitals, military hospitals. So we have got unified terminology for all of the health-related data. And then the standards catalog. We have got until now decided to 10 modified Australian versions, but these are the other standards including the HL7 and FHIR. And this is the Health Information Exchange, 15 interoperable use cases starting from the identifying the patients. And then we worked on the Health Information Exchange 9 policies, and these policies are mandated by the Ministry of Cabinet across all of the health sectors. And we had from the National Data Management Office, affiliated by SIDAيا, the Saudi AI and Data Authority. And these are the regulations, sorry that's in Arabic, but this is the standard and regulations for the telehealth that we have across all of the country, and these are part of the survey. We finished from this, all of the standards and policies. But how can we make sure that people are fulfilling these standards? We came up with the Saudi e-health maturity assessment in collaboration with HIMSS. It's similar to HIMSS, but that's national and mandatory. So we make sure that each health facility, hospital, clinic, labs, outpatients, that they fulfill these standards and compliance. And this is the data governance of the country in the health sector. This is the Saudi Health Maturity Assessment in collaboration with HIMSS that we have, and these the core dimensions and the domains and subdomains that we have. And this is the national platform, which is called NAFIS. NAFIS stands for, NAFIS, do you know NAFIS, what does it mean in Arabic? NAFIS means noble, but stands at the same time for this acronym, National Platform for Health and Insurance Exchange Services. And it includes both the clinical data and the admin, insurance, and financial data. And this is the hierarchy of NAFIS and the backbone of NAFIS. So, to sum up, based on our findings, on the experience that we have, we have got the 8 recommendations for any country, national, globally, that they need to have got sustainable digital health investment. And this project that we had in Oman from the same mimicking step by step that we are currently working in the vision of Oman 2040. First, to strengthen the relationship between technology investment and the business objectives, including the healthcare objectives. Promoting the transparent strategic governance and the investment priorities. So it's not wise that the government have got one direction and vision, while the hospitals and also the private sectors are going to another directions. Addressing technical debt in national ERP systems and in a constructive manners. Harmonizing digitalization efforts for financial efficiency and prioritizing for equity and digital health foundations to have good better healthcare, workforce, governance, standards, policies, and technology. Accelerating the time to impact through the financial and non-financial incentives to have technology and digital transformation that needs money. and this does need a huge investment. So the governments need to ease that and to accelerate the time to impact, and ensuring the thorough account for technology investment risks, and diversify the investment sources through the public-private partnership. تشكر درم for everybody, and thank you so much.